Are hemorrhoids just a pain in the bum? Hi, it's Dr. Fan here. Let's talk about hemorrhoids. Hemorrhoids are arteriovenous vascular channels in the anal canal. These are normally anatomical structures located in the submucosa of the lower rectum that connect hemorrhoid arteries to veins. They normally act as a seal to maintain continence, but can become problematic due to deterioration of connective tissues anchoring the hemorrhoids, increased sphincter tone, and abnormal distension of the hemorrhoids and straining veins. The main causes of problems are due to age or pressure, such as from pregnancy, straining, and constipation. Problems are most common around the age of 50 and have a self-reported incidence of around 5%. Hemorrhoids can be divided into two types, external or internal, depending on their relation to the dentate line, which is a transition zone between columnar and squamous cells of the anal canal. External hemorrhoids lie below this line, whilst internal hemorrhoids lie above. Internal hemorrhoids can further be graded depending on their severity. Grade 1 does not prolapse below the dentate line. Grade 2 prolapses with defecation but spontaneously reduce. Grade 3 prolapses and require manual reduction. And Grade 4 prolapses and are irreducible. There are no pain receptors above the dentate line, so internal hemorrhoids do not cause pain. Because external hemorrhoids lie below the dentate line, they can cause pain, especially if they are thrombosed. Nevertheless, the most common presentation for hemorrhoids is bleeding and a sensation of a palpable lump at the anal canal. The diagnosis of hemorrhoids is clinical, and both external and prolapsed internal hemorrhoids can be visualized during a medical examination, but internal hemorrhoids are not palpable unless they are thrombosed. A proper investigation for bleeding, including a colonoscopy, should be considered, especially if there are any concerns for colon cancer. The management of hemorrhoids can be non-operative or operative. Non-operative options include a high-fiber diet, avoiding straining, taking stool softeners, and the use of topical agents for symptom control, such as lignocaine, hydrocortisone, nitrates, and calcium channel blockers. The most common procedural treatment for hemorrhoids is rubber band ligation, which involves rubber bands being applied to the hemorrhoid above the dentate line to cut off the hemorrhoid blood supply and cause thrombosis. Without the blood supply, these hemorrhoids fall off in about 5 to 10 days, at which point there is a risk of bleeding. Alternatively, sclerotherapy can be used, which involves the administration of 1 to 3 ml of fennel oil into the hemorrhoid to cause sclerosis. These techniques are both around 80% effective for the treatment of grade 1 to 2 hemorrhoids. Grade 3 internal hemorrhoids require more aggressive treatments to control the source of the hemorrhoid, and this can involve the ligation of the hemorrhoid artery with repair of the rectoanal mucosa, also known as Haemorrhoids. Grade 4 internal hemorrhoids and external hemorrhoids require excision to be successfully treated. This is done in the operative theatre using energy devices to excise the hemorrhoids and their supplying hemorrhoid arteries. Thrombosed hemorrhoids are extremely painful, and an incision of the thrombosed hemorrhoid can be considered to relieve pain. This is best done within 24 hours, after which it becomes inflamed, swollen, and painful, regardless of the treatment. It is best not to operate on these hemorrhoids actively because they are swollen and more likely to result in more aggressive resection than necessary, compared to if the inflammation settled. This can actually lead to more pain and is more likely to cause complications. Complications of hemorrhoid operations include bleeding, infection, fistula formation, urinary retention, incontinence, and strictures. Following a hemorrhoid operation, patients should be sent home with analgesia, antibiotics, and stool softeners, as well as being advised to avoid straining, have a high-fiber diet intake, and have salt baths of the anus to relieve symptoms. Well, I hope that you have learned something new. Please listen to this again to reinforce your learnings, because repetition is a key part of learning new information. And please remember to like, subscribe, share, and comment for more videos.